Great, welcome everyone. I think we'll get started. There might be a few people joining us as the meeting goes on. Yes, feel free, as we said in the chat, to pop your name and location. We'll also be going to breakout rooms very shortly, so we'll have a chance to introduce ourselves in smaller groups as well. It's great to see so many of you in this online gathering, from fuel poverty to just transition, how health workers can join the fight to win. Medac's climate campaigning has a long history of divestment from fossil fuels within health institutions and developing the Health for a Green New Deal campaign, critical in outlining the public health case for our broken economic system, how our broken economic system needs to be addressed in order to win a livable future for both people and planet. And in recent months, we've built on the work we've done around the Health for a Green New Deal to focus on some of the key elements of that campaign, including looking at quality homes, energy justice, and the need for a rapid just transition. These are the three pillars that we need to address the growing public health and climate justice issue in the UK that is taking place in our homes. That is the crisis of fuel poverty and cold and damp homes. The purpose of this online gathering is to hear and learn from people who have been doing amazing campaigning, organising related to cold, damp and mouldy homes, as well as fuel poverty. And the aim is also to begin to strategise together how health workers can play a key role at both national and local levels to ensure homes are not sites of illnesses, but places where we can grow, live and thrive. We will be hosting a second online gathering on July 25th, looking at another aspect of homes and health, exploring the public health case for social housing. So please do join us then as well. After the breakout rooms, we will hear from 5 speakers who will bring insights around the root causes of cold homes and fuel poverty, as well as the different opportunities we have for action. And this will be followed by a short 15-minute Q&A. And after the Q&A, we'll have 15 minutes where we summarise some of the tools and opportunities for actions that you can take today, including a national open letter from health workers. We will invite people to share their questions during the Q&A, but feel free to pop questions throughout the event in the chat, and we'll start collecting them as well. So I'm going to hand over to Jess, who's going to introduce our speakers, and welcome back, everyone.
Hello everyone. Yeah, thank you so much for joining us, and thank you very much for our speakers for all being here. I think we've got some really inspiring speakers coming up, and I think maybe from a little bit from what we were sharing in our breakout room with the general election tomorrow, I think all of, there's that kind of sense of tension about what's to come, and hopefully some of these speakers can provide a bit of hope and inspiration about like what's happening outside of that structure of politics, but how we can also engage with that. So our first speaker is Simon from the End Fuel Poverty Coalition and Warm This Winter campaign, which is a broad group of anti-poverty, environmental and health housing charities and trade unions and campaigners. He's going to quickly cover a couple of things about our dependence on fossil fuels and the need for a just transition. So yeah, over to you, Simon.
Thanks. Thanks for having me. I'm just going to try and find, there we go. Got a few slides just because I'll mention some stats and it's probably easier to say them, kind of have them on screen. Let's see if I can get this full screen, sorry. It's been so long since I've used PowerPoint. I'm not quite sure what's going on anymore. But no, cool. Right, so thanks. Yeah, thanks very much for having me along. Just as I'm coordinator of the End Fuel Poverty Coalition, and as I'm not going to repeat who we are because that was very succinct introduction into who we are. So I want to sort of first of all just talk a little bit about why this is still a problem and why we're still kind of very concerned about fuel poverty, and the links perhaps as well between fossil fuels and fuel poverty. The headline is that energy prices are still 50 to 60% higher than they were in winter 2020-21. There's a missing zero there. And what we've seen is that the energy crisis has cost the average household, quite a lot of money in terms of bills. So and standing charges are especially punitive, especially for those who have low energy or no energy consumption. And one of the things that's obviously driving energy prices is our over-reliance on gas and fossil fuels. And just to kind of first of all, kind of hopefully give you some figures to help. I mean, even if we did what some people would have us do and take more gas out of the North Sea, there isn't any. There's 103 days worth of gas in the North Sea, which could be used for housing. But none of that would actually be used for us. It would go onto the international markets and it'd be sold at international rates and sold back to us at the prices that are still kind of massively too high. So that is not a solution. The North Sea is a declining basin. It has no more reserves left to give. It is not the future of energy. Neither in terms of domestic energy is hydrogen either. I mean, that is not going to be a sustainable solution to our energy. So that's why we need to see more investment in renewables and kind of a move towards electric heating. But that does mean we've got to bring down the price of electricity. Big challenges there in terms of that will require massive amounts of grid infrastructure improvements. And it also means that we need to reform the markets. So at the moment, some electricity is sold to the grid as if it was the most expensive unit of electricity generated during any half-hour period, which in the UK tends to be gas-fired power stations that generate electricity. So again, indirectly, the cost of gas is setting the price of the cost of electricity as well, and that's a reform that we need to see the government making so that we de-link the fossil fuels from renewables, and we pass on the cheaper cost of renewables to all of us. So that obviously is an issue, a regulatory issue, but that's sort of obviously one of the things that we need to see and we're campaigning for. I'm not going to go into kind of the impacts in terms of cold damp homes. I mean, obviously, you see that on the front line, and you know better than I do that as energy prices go up, we see kind of more people unable to heat their homes to an adequate temperature, or indeed in the summer cool their homes to an adequate temperature, which obviously kind of can have a massive impact on people. Again, it's the same vulnerable households that are affected in the winter will also be affected. Some of them will also be affected by heat in the summer as well. The figures show it costs the NHS £2.5 billion a day to kind of treat people coming to the NHS because of the impact of cold damp homes. We see children suffering in those conditions. Everyone remembers kind of the Arab Ishaq case and the impact that mold can have on children. Unfortunately, that is not an isolated case. It is widespread. Research that we did with the Social Workers Union found that the majority of children, social workers when they go into people's homes, the vulnerable children that they're supporting, they see mold in those homes, and that again is a public health emergency, and in some cases with children that will also store up developmental problems later in life. It is common sense says that if you're struggling to keep warm in your home, your concentration lapses, and again you'll all know far more than me the kind of the science behind all of that. So I just wanted to sort of highlight though that the energy prices do continue to stay high. These are the latest figures on screen at the moment. Even looking into next winter, we're going to see energy prices increase again by almost 10%. So we've had a slight fall now. The one thing that we also say about energy prices and why there's a problem is because of the soaring levels of energy debt. So people just simply can't afford, they have no more money to spend on energy. There's energy debt has gone up 57% in the last in the last year. I think it's 1 in 5 people in energy debt have turned to illegal money lending sources, which comes with its own kind of social problems as well. But one thing that we've started to point to, because we've only just had the research come through, is that actually it doesn't have to be this way. If more action had been taken by previous governments, and I mean that in the plural, and indeed across the UK as a whole, then that cap would be 32% below the current level. That predominantly is driven by reforming standing charges, by cutting VAT on bills, but significantly, and most significantly, by improving housing conditions. And if we can do that, and if we can have a government that is fixated on delivering better housing for people, then we will see the energy efficiency of that come down in terms of lower bills, as well as the wider public health support that will deliver. So what we've got coming up is a lot of work to do. We have a new government, hopefully, we'll have a new government, sorry. Need to be careful of we're still governed by the Lobbying Act. Hang on. We hope we will have, in whatever shape or form it comes, a new government on Thursday afternoon or Friday morning. And what we need to see is the government prioritise the things that need to happen in the long term, but also we've got some fairly short-term measures that we believe the government could be taking in order to cut the cost of energy this year. In terms of the sort of the main areas that we're going to be campaigning on, we've got a very intense first 72 hours where we have to kind of maintain the momentum that we've built up over the last 2 years to kind of ensure that energy and the cost of energy is high on the government's agenda, that there is work to be done in terms of reacting to and influencing what is prioritised for the King's Speech. We're going to look in more detail at the energy profits. I think in one of the previous slides there was a figure that said that there was £427 billion in profit generated by 20 energy firms. That's generally producers and transmission firms, rather than the people who supply energy to your homes, with the exception of British Gas, who make a lot of money. But we want to highlight that. We'll update that figure. There's a flurry of profits announcements at the end of July, so we're going to do it, but we'll bring them all together. We'll update the 427 billion figure and show just how much profit there has been made by the energy industry. At the end of August, there'll be an announcement for the winter 2024 prices, which, as I say, we expect to go up. There'll be the government's first budget. There'll be the party conferences. One area that we're not really up to speed with, but we need to be, is the role of markets. So every unit of energy is traded between it leaving the producer and getting to the supplier and then getting into your home. That can be traded up to 15, 16 times. Every single one of those trades involves somebody making some money off that unit of energy. We are going to update our data on the number of people living in cold, damp homes, and there's also, we assume, if Labour getting going to be an energy independence bill that we need to sort of try and influence. So that's quite a lot. I'm probably running out of time, so I'm not going to go through all the things that are on the right as well, but they're kind of the technical things that we're looking to influence and to change over the next few months. And I can go into those in more detail, but I just wanted to sort of leave really with just sort of what we think we're going to be saying. Again, haven't got a crystal ball, but I think all the polls are pointing in a pretty similar direction for the election results. And this is just sort of, obviously, if you want to use bits of this in what you say, hopefully it's useful, but we need to see the government, to end energy debt, protect households from the market, bring down the cost of energy, improve housing standards, and make Britain a clean energy superpower. That's how we fix Britain's broken energy system. There's enough money in the system to make that happen. And while bringing down bills permanently will take time, there are some things that we think the government can do right now. First of all, protecting households in this winter. Financially, that means more money or money off bills, reducing energy debt, more of a drive in terms of onshore wind and sort of speeding up the process to get more cheaper renewables. We need to see changes to the meters. We need to see forced installation of prepayment meters banned, and we need to see where there are smart meters that aren't working, we need to see them fixed so people can benefit from time of use tariffs. We need to have a much faster insulation and ventilation rollout. We need to see reform to standing charges, which is that daily bit of money that you pay for just connecting to the grid. And we need to see an end to energy industry profiteering. I mean, obviously that's quite a lot to do in the first few months of a new government, but that's what we're going to be pushing them for. So I hope that has been useful, and looking forward to the discussion later.
Cool. Thank you so much, Simon. I think it's really helpful to see those statistics there. And I think it just drives home again. I think that that number, that like 400 is more than 400 billion of profit, is just it for the like energy companies is just always astounding, especially when you see them next to the numbers of people in fuel poverty and fuel debt. And you know, and thinking about how our next government is going to influence that as well. And I think that really clear that, you know, you've got really clear steps, and I think that, you know, because sometimes it feels like, oh, what do we do in this like massive climate crisis? But actually having these clear things that, you know, that show that there's options and there's solutions to the immediate support that people need right now, you know, like the immediate financial support, then building on into it with kind of the housing and the smart meters, and then, you know, and reforming the energy system at the same time. You know, you've got all the steps there, and I think that makes for it, you know, a very practical guide for the government to follow. So I think that's really inspiring. Thank you for that. So next up, we've got Gavin, who's a community organiser from Living Rent, which is the tenants union based in Scotland. So really excited to hear about some of the organising that they've been doing there, and hopefully they're going to share some of the things that their kind of union members have been witnessing, and how they've made their voices heard. So yeah, good, take it away, Gavin.
Thank you for that great introduction. Yeah. So yeah, I'm Gavin. I'm based in Glasgow. I work as a community organiser for Living Rent, Scotland's tenant community union. Thanks for inviting me along to this event. And yeah, I don't have slides, I don't have the stats and all that, but I'm just going to be talking about our experience organising tenants, and how the condition of housing is directly linked to public health as well. So yeah, just very quick context. I'm sure for any of you that have visited Scotland or live in Scotland, it's no secret that we're a very wet and cold country. And surprisingly, our housing stock, whether it was built years ago or whether it was newly built, isn't really built for the weather conditions that we have. So it has led to terrible mould and damp across the country. It's kind of become the norm to have mould and damp, whether that's in the social sector or in the private rented sector. The main causes of this is like poor ventilation, poor insulation, and outdated heating systems, and even updated heating systems. It kind of is linked to fuel poverty as well. So the members of the union in Glasgow led a campaign last year against Wheatley Homes. Wheatley Homes is Scotland's largest social landlord, and we were trying to push them to treat mould and damp as an emergency repair, the way they would for a gas leak or a broken boiler, etc. They themselves had published a new policy stating that they did care about mould and damp. They were going to make it a priority, and they would visit homes within 48 hours of mould and damp being reported. Probably doesn't surprise you that that was not the reality. They actually took down that statement. That statement cannot be found on their website anymore. The reality of those 48-hour visits were that they were actually just inspections. There wasn't any repairs actually getting carried out within those hours, within that time scale. And then when repairs were being getting made, sometimes weeks down the line or months down the line, the repairs were completely inadequate. Most of the time just painting over the mould and damp. In some cases, painting over mould and damp on wallpaper. So the mould and damp is seeped into that paper and is still alive and well in behind that wallpaper as well. When they were doing like the paint jobs and stuff, they would be doing it on a monthly occasion because it would just consistently come back, and it got to the point where a lot of tenants would just carry out those repairs themselves, and the problem wasn't getting dealt with at all. In some cases, especially in the private rented sector, with some landlords and agencies, tenants were getting blamed themselves for causing the mould and damp. Because of like their lifestyle, they weren't opening the windows, they weren't putting their heating on, which again is linked back to fuel poverty. Some cases where families were abandoning just very specific rooms for health reasons. So they were essentially paying for a 3-bedroom house, but actually only using 2 bedrooms, which again would even lead to overcrowding in certain rooms as well. There was never any compensation given to tenants who were living in these flats in these conditions that were literally can go on to kill them, basically.
Stuart, I'm really sorry to jump in just because we're short on time today, unfortunately.
Yeah.
I just want to.
Yeah, I'll quickly wrap it up. But
yeah, go for it.
Like most of the cases that we took on were members who, when it's specifically mould and damp, they all seem to have health conditions, whether it was like asthma, COPD, and in some cases, one of the cases was lung cancer. And again, they've been forced to live in these houses. So we found that the most successful cases we took on where the repairs got done in a timely manner and were treated like an emergency was when health care workers kind of became allies. So we would reach out to GPs to send letters to the landlords or to their social landlord stating that there was a direct link to their patient's health to their housing condition and the mould and damp. It wasn't always easy to do that, to get doctors on board and to link the housing conditions to the health. But just to very quickly finish off, I'm really quite glad that Live and Rent are going to be working with Medact going forward to bring tenants and healthcare workers together to fight for change and ensure that everybody lives in a safe and healthy home. So to all the healthcare workers that are here today, it is key that we do get organised and we, work together to fight back and win better housing conditions, which will lead to better health. Thank you.
Wicked. Thank you so much, Gavin. That was very energising and I mean heartbreaking as well. And thank you so very much for sharing those stories of people's lived experience of these awful conditions. And I think, you spoke to that thing of individuals being blamed for this, like societal problem, but then also we see these big companies really just trying to like rinse it out and actually what the cost of that is people's health and people's livelihoods. And that's why we're, that's one of the reasons we're here today. And it's so powerful hearing those stories of actually when the health workers have been able to lend their voice to, or join as allies, and the difference that's made. So thank you so much for sharing that. So just moving swiftly on, our next speaker is Dr. Izzy, who's a Medact member and public health doctor, and she's currently doing research in housing and health, very aptly, and she's worked as a medical doctor and on public health issues, including climate change and extreme weather, air pollution and mental health. So she's going to talk to us a little bit about why this is a public health issue, as Gavin's just spoken to as well, and then and how we can organise as health workers to combat it. Take it away, Izzy.
Great, thanks so much, Jess, and thanks for the invite. Thanks, Gavin. That was really great to hear your perspective, and I'll briefly touch on some of the work that I've been involved in with Medact on kind of some similar topics, but I'm going to do a kind of whistle-stop tour of kind of the health perspective on this, which, yeah, Simon kind of gave us a bit of an introduction to some of those health impacts that we see from this. Obviously, yeah, these pictures kind of sum up, I guess, the kind of links between fossil fuels and health at that global level. And I think fuel poverty really brings that to the local, to the very personal. So that's kind of part of why I've ended up, I'll go to my next slide for some reason. Stay down here. Getting involved in that in my kind of PhD research was yeah, wanting to kind of see what that means at the more local level. So yeah, I think this has been touched on. I think Scott will probably go into it a bit more later, so I won't go too much into it. But we know that inefficient homes are really prevalent in the UK. We have some of the worst housing stock in Europe. We have really, really leaky homes, really kind of pervasively in this country. A lot of very old homes that haven't had a lot done to them over time. And we know that that is a really key driver of cold temperatures inside and of people being in fuel poverty and struggling with that kind of those horrible choices between heating and eating that we kind of hear about in the press, and that many of, as healthcare workers, many people's patients are often dealing with, cause huge amounts of stress and physical health issues, as well as that resulting in lots of energy being wasted because it's just kind of leaking out through drafty walls and windows. And this is largely down to kind of policy failures, which I think Simon alluded to. So here you can see how many homes were being insulated every year before the policies to kind of insulate homes en masse were scrapped in 2012-13. And then this is how that's just like dropped off a cliff. And this is how we would need to get that back on track to kind of be in line with Committee on Climate Change recommendations. So I think it's useful to sort of like bear this, which is from the CCC, this in mind, that actually like this is avoidable. There's something going on with some animation of my slides, so apologies about that. And this puts people much more at risk of damp and mold. There's an issue here as well in terms of just the sheer number of homes that don't yet meet energy performance certificate standards, which is like over half of homes aren't yet at that standard. So this is like an incredibly common problem. And more broadly as well, in terms of like the other issues that are really common in homes, an even kind of lower level standard that homes are expected to meet is the decent home standard. And nearly a quarter of homes in the private rented sector aren't classed as decent homes, like they're not really fit for human habitation, essentially, which I think is quite a kind of shocking statistic that they don't meet that decent home standard. This is a real justice and inequalities issue because it relates very much to so many other inequalities in the way that our housing system is constructed and who lives in which homes and who is able to challenge these conditions. So this very much intersects with the nature of power and the way that our housing system works. So the people that are most affected by these issues of cold, damp, mold, also overcrowding, broader issues of disrepair, and an inability to actually raise and challenge them for fear of risk of like revenge evictions, are people on the lowest incomes, people in the private rented sector, people that have health conditions and disabilities, obviously much more vulnerable, but they're also most likely to be in some of this worst quality housing. Young people are most likely to be private renting, and people from minority ethnic groups. So there are these intersecting injustices and inequalities that affect who is most vulnerable and most impacted by these inequalities. And that's partly why this is so much a health justice issue. And this has got worse over time because of the shift into the private rented sector, which we're releasing a briefing as the Housing and Health Group in a couple of weeks' time. You can find more information on the MEDAC website, but that kind of details the intersection with broader changes in the housing system, which is very much also a part of this picture and puts people in harm's way in this way as well. How does this affect health? you'd probably be aware of impacts on the respiratory system, things like asthma, COPD, which is chronic obstructive pulmonary disease. But you might be less aware of impacts like on the circulatory system, so on the heart, but even stroke risk on the brain, and on mental health and well-being. I know Simon talked about cognitive development for young children and their educational attainment, but even, less commonly thought of things, grip strength in arthritis, overactive bladder syndrome. There's now some evidence of impacts there, and the risk of being hospitalized for just all-cause conditions, and the risk of death. So on average, there are about 45 extra deaths every single day last winter. So that's thousands of deaths across a whole winter. And there's more detailed information in the Medact briefing that's being launched today. So this is something that really affects almost every system in the body, in terms of the impacts of both cold and damp and mold. I'm conscious of time, so I will skip through. But there's something I guess I wanted to touch on as well, which is the fact that it's not just about insulating homes and making them warmer, but it is about also avoiding harm in that process and ensuring that that's done in a holistic way. So we know that there is a risk when making homes really airtight and kind of warmer, if that's done poorly and if it's not done with thought, that you can worsen the indoor air quality, you can make them more at risk of overheating, and you can create fire risks, which, like we saw with Grenfell, for example. And also there are some risks to workers if they're poor quality insulation materials and nasty chemicals involved. So I think as health workers interested in justice, interested in just transition, it's really important that we think about how we mitigate those risks and address inequalities in that process and in our advocacy. So pushing for safe, sustainable, non-flammable insulation materials, arguing for whole home retrofitting approaches, and kind of sustainable and high quality green jobs being perhaps part of the solutions there. And I think also monitoring, like research and data, can also be part of how we can understand and manage those risks.
Sorry, Izzy, just to say we've probably got about 1 or 2 minutes left.
Yeah, this is my last slide. So with Medact, we've done quite a lot of advocacy in the housing and health group, and it hasn't like specifically focused on kind of cold. It has quite a bit focused on damp and mold, particularly in Harrow. Geordie on the call might also be able to answer a bit of questions around this in the Q&A. But I guess the point here is really that the value, I think, here is in working, I think as Gavin said, working really closely with tenants and community groups, and the value of that joint working, listening to tenants, seeing where healthcare workers can like add value and not lead it, but like be led by the tenants, see where we can strengthen their voice, what's useful to them, and not just work in like a sort of old school traditional way, but like what does joint working really look like? How can we act in solidarity? So we found some things helpful there in terms of surveys, and then using the data that was collected anonymously to present that to the council. And we're trying to kind of do a similar thing now in Tower Hamlets, and we'll see how that goes. That's something we're sort of trying to do a co-production approach, I guess. But that's in progress. So happy to say more about that in the Q&A, but like conscious of time, so I will kind of finish there. But I think, yeah, basically a lot of similar lessons to Gavin's on that. So and there's a need for national structural change fundamentally. That's probably my biggest takeaway on that. So I'll stop sharing.
Thank you so much, Izzy. You've spoken to so much there. I know it's really hard to fit in. I'm really sorry about cutting people short when yeah, I think what you've touched on some really key things there about the intersections of this injustice, why this particular issue is so important for us to all get behind, because it links so many different inequalities and injustices, and is a place where we can make real change. And I think the other thing that I really just wanted to pick up on is that how we can support tenants in their fight. I think often health workers have a tendency to come in and with a bit of a saviour complex, but I think actually the importance in this movement of being guided by and led by those already doing fantastic organising, and it's just how we can support them with that, and great to have some examples of that already happening. So thanks very much, Geordie and Izzy, for getting that going. So yes, our next speaker is Stuart, I believe. Yeah. So Stuart's from Fuel Poverty Action. So they're campaigning to protect people from fuel poverty, basically. And they're challenging in many different forms some of the greedy energy companies and the unfair policies that leave people enduring cold homes. So Stu, if you're happy to take it away.
Yeah, thank you. I'll try and be brief. Well, as has kind of been mentioned, the general election obviously looms large, and many people have cast their predictions on what the result of the next government will look like. But I just wanted to share one prediction of my own with you, is that the new makeup of the Parliament will be full to the brim with landlords who will continue to drag their heels on promises for protection against eviction, rent control, social housing provision, home insulation, and talk publicly about shared national interests while privately profiting from our homes and leaving us to endure cold, damp, and disrepair. When we say affordable homes, for me, that's talking about all of our costs. So rent, utilities, council tax, bedroom tax, and as Simon mentioned, energy bills remain about 60% higher than they were in 2021. And nothing has fundamentally changed since then. The energy system remains just as vulnerable to further price spikes in an increasingly unstable world as well. Labour never had a plan to resolve the crisis and still doesn't. Just like the Tories, they don't want you to talk about energy bills anymore. Great British Energy, as they call it, is their single answer to all our energy woes, you know, bringing down bills, delivering net zero, creating new jobs, providing public finance as well. But they're already backtracking on claims of what it will deliver, and none of it is going to be achieved while they offer next to nothing in investment. What was first imagined as a publicly owned renewables company will now be mostly in the hands of private companies, with a minimal proportion of public money going towards mainly false solutions like carbon capture and storage, hydrogen, nuclear. And as health workers, I think there's room to speak out on this, you know, across health, housing, energy and water, joining the dots on the need for democratisation and public ownership of essential services to deliver public wellbeing. While 40 years ago we had publicly owned energy and private landlords were thought to be on the verge of extinction, now for me both these sectors have reached the levels of the banks in 2008. They've torn up and thrown away the social contract themselves. They're acting as if bound by no legal or moral obligation because they're in league with the members of parliament who are invested in them. You know, a key example of this was the forced prepayment meter scandal. You know, a practice that's been opposed by FPA for years of energy companies, hundreds of millions of pounds in the pink, putting in people's doors to force them onto PPMs over debt as little as £200. You know, we oppose any punitive measures against people in debt, but energy companies ignored even the limited conditions placed on them. They targeted the elderly, disabled people, and families with young kids, leaving them to be cut off if they couldn't top up their meters. One of our members was actually, with mobility issues, would be left in the cold and dark for hours at a time until a friend or a family member finished work and could come and get their meter topped up again. You know, we've opposed the practice since its foundation, but it was actually collective organising at all levels, from Parliament to the streets, bringing together pensioners, disabled people, climate justice groups, MPs, journalists, that pushed the government to suspend forced PPMs. And we turned a 6-week pause into an 11-month moratorium in the end. And while Ofgem's lifted that ban, we need to build on that win. So public ownership is one battle that a lot of people have taken up, but we need to ask, as a pathway to what? You know, the strength of the NHS isn't just publicly owned health, it's the principle of universal healthcare free at the point of access. And across key sectors from energy to housing, that's the battle we should be fighting, in my opinion. This is what FPA's Energy for All campaign is about, you know, supported by MedAct and countless other organisations. Number on the panel, actually, End Fuel Poverty Coalition, Live and Rent. That's enough energy guaranteed to cover the basics that we all need to survive. So adequate heating to protect us from illness due to cold, damp and mould, hot water to wash ourselves, our clothes and sterilise, kitchen tools, baby bottles, medical utensils, cooking healthy, nutritional meals and powering not only lights, fridge and freezer, but taking account of individual household needs like ventilators, dialysis machines, stair lifts, hearing aids. This is what Energy for All is all about, and we'll achieve it by turning the energy pricing system right side up. While currently we cover operating costs of energy companies, paying those standing charges mentioned, £300 a year before our money buys a single kilowatt of energy. We want to ditch those charges altogether and demand that any company in operation is obligated to meet the needs of its customers with the money coming out of their profits, their dividends. That's crucial, is the return of the theft of our incomes. The solution put forward by the energy industry itself and many charities in the sector as well is other reform proposals like the social tariff. The reason energy companies are advocating for this is because multiple variations of it won't affect them, providing subsidised bills for a few, paid for by the rest of us either on our bills or via taxes. Another factor unaffected by social tariffs is the climate crisis. A minimum energy guarantee with the burden shifted off of our backs and onto the private companies and government to deliver will incentivise the change we need, not just in energy production, but also crucially on energy efficiency. So that brings me back finally to our homes. All of us want affordable, healthy, well-insulated homes, but successive government schemes have been disastrous. As Izzy spoke about, bad retrofit jobs have left people worse off than before. Years of cuts to training and apprenticeship schemes, while profiteers and cowboys exploit schemes paid for by public money. Failure to repair leaky homes before insulating, creating damp or cold pockets. Use of carcinogenic or flammable materials, and lack of ventilation promoting mould growth, polluting indoor air, and leaving homes boiling hot in the summer with tenants' costs and energy demand as well, replaced by fans, dehumidifiers, and in some cases air conditioning. But maybe worst of all, a conspiracy of silence on all these issues across the housing sector, government departments, and even among many of our allies who talk about climate and social justice, but in reality can't see past what funding is available. So to combat this, in addition to our Energy for All campaign, Fuel Poverty Action plans to launch a new project, a Healthy Homes Guarantee, a comprehensive set of standards enforced for all retrofit schemes, conversions and new builds, investment in training to deliver the skilled workforce we need to deliver the retrofit revolution we all want, and a radical policy rethink that ensures home improvements focus on improving people's lives and living conditions, not just meeting targets and keeping donors happy. A Healthy Homes Guarantee is about health justice, education justice and labour justice, and I think you as health workers can play a key role in pushing these demands that support people and planet. Thank you.
Thank you, Stu. That was really powerful. There was so much in there. I think you've spoken to it. I think we can't, whatever happens tomorrow, I think we can't leave this in the hands of the government, whichever government comes in, and the importance of taking it into our hands and organising. Long live the retrofit revolution of that. Organising community-owned resources. I think probably when people dreamed up the NHS, people thought it would be a crazy, wacky idea. And actually dreaming of a community-owned energy system that works for the people it's supposed to, rather than people profiting off it, feels radical, but makes so much sense in so many ways. So, yes. So anyway, sorry, briefly. So on to our next speaker. Also, I'd love to hear more about some of the campaigns that you've been doing, Stu, because it sounds like you've had some real success there. But yeah, on to our next speaker, Scott, who's from the Anthropocene Architecture School and Architects for Climate Action Network. So Scott's a specialist in regenerative designs and infrastructure and ecological building materials, and he's taught thousands of people internationally about the intersections of the built environments around us and climate breakdown and the importance of a just transition. So yeah, that very aptly following on, Scott, take it away.
Thank you very, very much for having me. And following Stu after that is going to be really hard. But for what I'm essentially here to do is to talk about the possible and to really to reassure that as a society, civilization, and a building industry, we know how to deliver the types of homes that we want to see. We can deliver incredibly low energy homes, so I'll touch upon that briefly. But also it's facing the fact that our housing and energy systems are simply not broken. They are working as they were designed to. They did not have health or even life at the heart and soul of them. And to really set the scene initially, one statistic that I kind of think really stands out to anyone that I've ever told is that 40% of all of the money any nation spends on healthcare is directly attributable to its built environment. So 40% of all that is such a waste, and we know that and have known it for years. It just needs to be spoken about to more people and to be common knowledge. But really, just to jump in, kind of really, really bluntly, the housing is no longer looked at by government as a place for us to simply live and nothing else. It's speculative investment for people. It's a work stream for others. It's a mortgage, essentially. It's a pension replacement for landlords. People are priced out, but this is a system working as it was intended. And to reinforce, market forces are also just a fallacy because these are all made by human decisions. Every single infrastructure you can imagine, so it doesn't matter if it is a energy system, a pipeline, a hostile environment, all of these began in a human imagination and all of them can be changed. They are not fixed in any way, shape or form. And we need to start speaking to them about that because by calling them broken, we're actually distancing ourselves from imagining how good the alternative could be and looking beyond it to the possible, because the possible is fantastic. That's what I'm going to try and stress. I'm going to try and bring the stuff that keeps me up at night in terms of what we can actually do and not seeing that happen. It's an incredible frustration, and show what is actually possible. Because again, like has been touched upon incredibly strongly, like our lived reality is that costs of survival are being raised by these decisions affecting our housing and energy systems. Energy costs are skyrocketing, food costs are going up, and we are effectively, our homes are showing the signs of energy becoming more expensive. Damp and mold that we're seeing is becoming increasingly more prevalent, more visible, because we cannot afford to keep inefficient homes as warm as we used to be able to at cost. So because of that cost rising, homes that were already in a bad condition that we were able to gloss over by affording cheap energy that the UK had access to because of post-colonial means is now no longer possible, and that's becoming more and more prevalent. So we really need to stop talking about them as broken. They are working as designed and need to be replaced. But you've seen the graph. So I was also asked really to talk about the political context and what got us to this point where our homes are becoming lethal environments for many people. And because back in 2013, there was this grandiose negligent statement of cut the green crap, where all of these things that were beginning to build in momentum towards not always doing the best job, but trying to improve homes' energy efficiency were slashed. And this kind of cutting the green cap has added about £2.5 billion around to the consumer, to us, to society as a whole, simply because this was cut. But then as we go into years after that as well, we had a kind of code for sustainable homes in the UK that was actually quite progressive, even for the UK, and we're quite shit at everything else in buildings. But this was scrapped, and the claims from government was they slashed about 90% of building regulation around houses in their own statements. But it goes from terrible to worse when MPs have tried to push through and to try and call on endorsement for bills that mean our homes are fit for human habitation, they are consistently voted down. So the people being voted in are voting against the interests of their electorate that they represent. So our voting system is not actually proportionately reflecting how people are feeling because it's not actually representative. But attempts to reform this system incrementally have failed. And through that disproportionate system we have in government have failed. So homes are not guaranteed to be fit for human habitation. And as we've heard from the other speakers, that is the lived experience of more and more and more people, and it's becoming more prevalent as it's touching more people. And when we look at like government ambitions kind of brackets, it would take 300 years, as the kind of National Energy Action have looked at, being a Great British Insulation Scheme. So 300 years, like that is not a government policy that's caring about human lives as people are dying every day in winter. But also, as energy efficiency measures that were going to be brought in were cut back in 2023, that is projected to add over £8 billion to energy bills of the British public over the next kind of like 10 years. So we've had that over 10 billion will be added simply by cutting energy efficiency, because a huge part about kind of this crisis we're facing and kind of cost of survival is that the homes we are living in are not efficient enough to make them cheap and affordable to run. Until we make them affordable to run, we're going to constantly be looking at the energy generation problem, which we need to be talking about demand reduction on a national scale. So to really introduce how terrible our regulations are, so just last year, the average new build home was 5 to 6 times less energy efficient in heating terms than a newly built passive house. This was a standard developed in Germany for rigorous testing in the early 1990s. So we are 30 years behind what is possible in the United Kingdom. And this table here shows you the kind of distribution of the kind of heating demand of different buildings. But we can also retrofit homes to be 3 times more efficient than a new build home to today's minimum standards. So our building regulations are a point that needs organised around and targeted, because those building regulations are doing harm by being inadequate. And that's something that the climate movement and health workers could make a lot of difference to supporting voices who've been shouting into the void of the industry for years on end. But also retrofit is not just throwing insulation at things. I'm really happy we've had it mentioned about increasing ventilation to make sure these homes are actually healthy to live in. Because this is about adapting homes and upgrading the kind of built environment generally, but it's also about meeting people's needs. And it's about stewarding buildings into the future, because in the United Kingdom, we have designed obsolescence even into our new buildings. And we knock down about 50,000 buildings every single year that could be retrofitted, and so many empty ones as well. So retrofit is not just a simple, you insulate it in that, it's a whole house, holistic. It's looking at the home as if it were a kind of an ecosystem or a body, and treating it as such and taking care in that response. Because lots of research has been done on this, which I'd thoroughly recommend diving into. If I could put links on this, I'm happy sharing everything. So it's incredibly complex as a problem in increasing the uptake, and even in supporting the industry. Our supply chains are a problem I could talk about for about a year and a half. But there's lots of great research from the likes of Dark Matter Labs on the system problem around retrofit. And also some mapping was recently done by the same kind of organisation that shows what parts of our public services are directly paying for the damage done by poorly maintained homes, by landlords and by housing providers. So we can actually trace and see where all these harms go, who's being affected and how it's being felt. And we all know that 40% is incredibly visible of how that healthcare cost to the people around us. And also, even when it comes to the kind of climate crisis, our government response is woefully inadequate and just as dangerous, because new standards coming in are looking at making homes even worse than they are today in these new regulations. So that's the government's ambition, is to get worse and let it get worse. Because research carried out by the British Research Establishment, BRE, found that kind of poor housing costs the NHS about £1.4 billion, give or take, lots of different statistics. But if you did all the work that needs to be done on poor homes, it would pay off the wider societal costs in 1 year alone. And our government has been operating having been told that and having known that for a long time. And again, these are human decisions that people need to be held accountable for. And in terms of the climate crisis, about 1/3 of all the energy we use as a civilization is used in our buildings. But about 38% of all the carbon emissions on Earth are used in the creation or operation of our built environment. So it's a huge contributor to the climate crisis, but that can also be looked at one of our biggest places for opportunity as well for doing great things. So the Passive House Trust did some research in early 2021 to work out how many homes we had to retrofit, how fast, how many people we needed to employ to hit our minimum net zero target. And to make this really fast, that's 2 million people. And we only had 135,000 in that industry at that time. So to put that into perspective, that's a workforce that we need that's half the size of the NHS. We need a workforce just to do the domestic house retrofits of 2 million people. That is looking at the numbers from the case of what we need, not what we believe a system that's not designed to hit that is going to provide for us. So that's the number of people we need to hit the minimal bar by 2050. So it's probably increased significantly by now because we've not been doing it fast enough. But to put that into perspective, I'm going to take the just transition away from just talking about energy, and I'm going to combine energy and housing at the same time. So for every one job...
1 minute.
Yep, got it. For every one job in oil and gas, there are 3 potential jobs in renewable energy, which is fantastic. But for every one job in oil and gas, there are 77 jobs that needs to be done just in domestic retrofits. So that's a huge proportion of all of this. We cannot shift away from gas because of jobs is not true. And we have to challenge that loudly. But this 2 million is a part of a wider just transition that includes decarbonising the health sector, includes decarbonising sport, health, entertainment, all of our national infrastructure. So we need millions of people. And that scale is beyond comprehension or anything we've done as a country before. Because housing justice, like, we really need to make this a foundational principle of a just transition and not just talk about energy generation and renewables. Because there's an incredible example of the Woodside Flats in Glasgow, where one family had not turned the heating on for 2 years during a cost of survival crisis. So if you can imagine how it would feel for you personally to have not had to turn the heating on for 2 years in your flat, because that is entirely possible. So just to really quickly round up, as part of a festival last year, Retrofit Reimagines, that we took across the kind of whole of the UK, bring together people doing different work in the sector, asking the question, what if the climate transition of our homes, streets and neighbourhoods were designed, owned and governed by the people who live there? And the responses we got were incredible. There's a film that's going to draw this together, being released in the next week and a half-ish. And we identified 6 big shifts we need to see if we're going to take this into community to ownership and really drive it forward in a just and equitable way. So I'm going to pick 3 of those, and I'll end on quite a nice short one just to kind of hammer the point home. But we need to stop looking at the retrofit of our homes and housing as an individual person, individualized problem, and start looking at it as collective. So collectivizing block by block, street by street, opening that out, because we cannot do this as individuals because our housing system is designed to atomize us, to make organizing harder. We also need to start looking at, from house by house, to looking at our streets as living systems. So how do we bring back the biodiversity and the wildness that we have eradicated from our streets and our cityscapes? How do we increase the spaces for us to talk to our neighbours, to meet people in passing in the street? How do we bring back growing food into where we live as well? So looking at this by this wider living system, because it's all interconnected. And this last one before my final slide is like probably the hardest point I can hit home about this. We need to stop looking about this as short-term, single-year, annual campaigns. We need at least a 5, 10 to 20-year vision of collective organising around the home as a frontier for a just transition and unlocking our capacity to change our countries. Because there's a really powerful quote that Naomi Klein used in her book called On Fire, The Burning Case for a Green New Deal. And it's frankly haunted me ever since I heard it. And it's very much that it just so happens that we're all alive at the last possible moment when changing course can mean saving lives on a truly unimaginable scale. So all the organising that we do in housing is saving how lives work. It's improving lives, but it's fundamentally about saving lives and looking after one another. And all of this is an act of collective care that we can all take part in. And I'm incredibly encouraged to see that there's community-led groups and groups that listen to their members first, like Fuel Poverty Action and Living Rent, who are going to be supporting this kind of work with health workers. So thank you very much for having me. And I hope just some of the possible is a bit uplifting as a note to finish on, because we can 100% do everything we need to do technologically. It's just about taking away the political barriers and taking away the cultural and social ones as well to having a better world. So thank you very much.
Thank you so much, Scott. Such a powerful ending. And I think that was you gave so many rebuttals to so much of the rubbish that we hear against all of this. But also you gave some really important facts about how we can go forward with it all as well. And yeah, it's a collective act of care that we're doing when we do this organising. So yeah, I'm just going to take it to some questions now. After that talk, just to see if we can squeeze some in. And I know that Simon's gone, but there was a great question in the chat from Tom. Tom, if you're happy for me to just read it out from the chat, maybe that, and then we can. I think Simon's posted a little response to it, but if any of the other campaigners want to jump in on it. So Tom's asked, with those energy companies, 20 energy firms that have made 427 billion in profit in the recent years, would it be helpful for there to be legal cases and legal challenges against them? And Simon, I'll just kind of quickly read out Simon's response. So Simon said, often those companies are guided by I don't know how you say the abbreviation, but the Office of Gas and Electricity Markets. And so maybe there's a way to challenge those energy companies through that. But I just wondered if any of the other campaigners wanted to jump in on that as well. No worries. If not, we can jump to the next question. I just wanted to make people aware of that question in the chat there. So I think the next question was from Nishka, So I don't know whether, Nishka, you wanted to hear a bit more about some examples of the kind of co-production approach. And I think this was maybe directed at Izzy, thinking about how we address those inequalities that you spoke to. I don't know whether you want to come in on that.
Yeah, do you mind reading out the whole question for me? I'm on my phone now.
Yeah, I can speak to it.
Or,
Just
yeah,
wondering,
great.
because I know that the time was short, and I'd love to hear more about just your approach to co-production, how you meet and organize with tenants, how you get like their voices heard, and some of the suggestion. I think just the slide changed quite quickly, so I couldn't see some of the suggestions that you made, that you listed there for addressing some of the inequalities that you spoke about.
Sure. Well, so I guess Geordie might also want to come in, who's the MedAct kind of economic justice and housing and health kind of organizer, that with others. I think Cal's on the call too. But yeah, so the work, I think, has been a lot of like learning and things in terms of what we've been doing there. So with Harrow, we found out through work with Harrow Law Centre that there was a particular block that had very bad damp and mould issues. And Geordie worked with a colleague at Harrow Law Centre who was really great, who had contacts with residents of that block, basically to kind of start understanding what was going on then. Harrow Law Centre sort of started setting up some meetings and basically help kind of get an understanding of what had been going on, that people had already previously been raising that to the council without much success for quite some time. It had been being ignored, like repeatedly, systematically. I won't go into all of the details, but in essence, we kind of put together a survey that could be done with tenants to gather the experiences they were having, the health issues that they had before moving in, and how and now that they were living in the flats, across various different health areas, and also to collect like photos of the damp and mold that were in specific flats across the building and in the communal areas. And we collated that data. Geordie did like a ton of this work across basically residents in the block. Pulled that all together into a kind of summary report and ended up sending it to councillors in the council to kind of raise the issue up their agenda and put a lot of pressure on them. Also Geordie took it to council meetings to kind of raise it that way. And that was a kind of an in, and I think bringing the health angle essentially to say this is putting people's health significantly at risk, and it's clearly not been addressed adequately in the responses so far. It's just been kind of painted over, like Gavin was saying. And the issue, it's actually a really complex story that I wouldn't have time to go into now. There was some enforcement action taken, and that has then fallen a bit flat in the interim since. So, but I guess still, I think kind of some useful learning from that process, and from there then trying to influence the council's enforcement policy, so getting them to take a more formal stricter enforcement policy on private landlords, so not just about that individual case, but taking the learning and changing the broader policy, which basically I think is huge testament to like the incredible work that Geordie in particular has done. But I think having the health arguments and the health data that we collected, like working with those residents, I think was really crucial in being able to put that pressure on the council. And I think we tried to recruit quite a lot of local health workers as well, with some challenges. And I think that's something that seems to be a little bit easier in terms of East London. But yeah, that's basically, I guess, how it's gone in Harrow. So
thank you so much, Izzy. Sorry, I'm just aware of time and wanting to be respectful of everyone's evenings. So unfortunately we haven't got time for that many questions, and very aware that there's a wealth of experience in this virtual room of people who've been doing this campaigning and have been linking up with Health Voices, with tenants, and we really want those actions to be to be able to be taken forward. So I'm just going to hand over to Kate, who's going to talk about maybe some of the actions and how we can take this all forward. So thanks, guys.
Thanks, Jess. Thanks, everybody. Yeah, a massive thank you to all of our speakers and great questions. I'm really sorry we've not had time to get through them all. So much to cover, so many ideas and thoughts, and we're taking all into account and made a note of everything. It's been really inspiring. I hope you found it inspiring too, to hear from such a range of voices coming at this from all different angles and different pieces of the puzzle. And we can tell from the questions there's a lot of appetite for action. So I'm just going to spend a few minutes going through that now. And it's so exciting to have so many people from all different parts of the country joining this call, from Kent to Sunderland to Glasgow. It feels like an amazing step towards building a strong movement of health workers getting organised at a national and local level to build power. So we're super excited to share with you a bunch of resources in our Homes for Health toolkit, which we should be having posted in the chat now, to help health workers and others to organise effectively on these issues. So I'll just walk you through them before releasing everybody to their evenings. First of all, we've got our briefing, which is the public health case to warm our homes, not our planet. And it's been brought together by collective work of lots of members and input from partners too. Huge appreciation to everyone involved. And it's a short, easy read document designed to communicate the root causes of this crisis, the health impacts, and our demands, how to address it. So it brings a lot of today's information together in a digestible place and really useful background to build our knowledge. Then second of all, our friends over at Neon have helped us to develop an incredible messaging guide designed to help health workers to communicate around these issues, think how we can build powerful narratives that are really clear and clearly name who's responsible, and use the health framing to talk about housing and energy issues and lay out solutions. And the power of health workers in bringing home the real impacts is something that Simon spoke to there as well. So that's a really useful read. And thirdly, we also want to share our open letter, which is calling on the incoming government on behalf of health workers to take action on the crisis of cold and damp homes. As of tomorrow, as we know, it couldn't be more urgent that we're putting pressure on our new political leaders to take action. And it's also a way to build the movement and raise awareness of these issues and the health angle. So we want individuals to sign it, but also health organisations. So if you're based in a health organisation, be great to get them to sign it, and also to share with your co-workers and your networks. So have a look at that toolkit, but it's just the beginning of what we've got planned locally and nationally to take action over the next few months. Together, we're going to be building our skills, our knowledge, our community. So whatever your level of experience or whatever you feel you have to offer, we need you in our movement. So come along to meet some friendly faces and learn more about how to get involved at our new joiners meeting, which is on Tuesday, the 3rd of September. Be a welcoming space to find out more about our work. If you're super keen to get involved before then, email Maria. Her email address should be in the chat. And we're also sharing a link to our WhatsApp community group where you can get all the latest updates. And then before we wrap up, last but not least, we've got a reminder for the second event in this online gathering, which is very intertwined with what we've discussed today, which is the public health case for social homes. And that'll be on Thursday, the 25th of July. So register, the link is in the chat. We've covered loads. I'm feeling really energized. My brain's very full. I'm looking forward to digesting that. So that's it for today. And a massive thanks again to all of the speakers and everyone who's been involved in putting this event together, and everybody who's come along tonight. It's been really wonderful to come together and have these conversations, and feel really excited for what's to come. So hope everyone has a really restful evening, and solidarity with all of the amazing organising we've heard about that's taking place all across the country. And we hope to see you very soon.